In this lecture, I will talk about cardiopulmonary resuscitation in a general practitioner's clinic or in the patient's house. When a patient's breathing has stopped suddenly, you are dealing with a patient of cardiopulmonary arrest. The resuscitation should begin immediately. You may only spend a few seconds to auscultate the heart or feel the jugular pulse, but even doing that, you may be losing precious time. You have only 3 minutes before permanent brain damage starts setting in. First, make the patient supine on a hard surface or on the ground and start giving external cardiac massage. Then take a handkerchief or a piece of gauze and place it over the patient's mouth and give mouth-to-mouth respiration after every fourth heart massage. Once this artificial breathing and cardiac massage is started, call for help and then take time in between to prepare and give injection adrenaline 1 cc intracardiac, injection efcorlin 2 vials intravenous, and injection soda bicarb 2 ampoules intravenous. If with this vigorous and quick treatment, heart and breathing do not recover, then the patient is probably lost. But if breathing starts recovering or pulse is felt and heart sounds are heard, then start oxygen, keep watching the pulse and breathing, and shift the patient to a hospital quickly. During transport, the cardiac massage and artificial breathing should continue where necessary. Now, I will tell a few points of practical importance. If the heart and breathing have stopped, then first start artificial breathing and cardiac massage. Then go for injections. If you first give injections or start searching a vein, then by the time you start cardiac massage, brain damage will already have occurred. So cardiac massage and artificial breathing should always be the first step. If you are keeping inpatients, I would advise you to buy a resuscitation apparatus with ambu bag and a face mask. It gives very good artificial breathing and its use is much more effective and safe than mouth-to-mouth breathing. You can also connect oxygen to the ambu bag. Every nursing home must have this resuscitation apparatus. It also conveys a message to the patient's relatives that you are doing your best efforts. Many times, a patient will be already dead by the time you see him. Still, if the death is very recent, you should give external cardiac massage, intracardiac adrenaline, and see whether the heartbeats return. Only then you should declare the patient dead. If the patient is dead long before you see him, then ask in details how the death occurred. If you have been seeing the patient regularly, then it's okay. But if it is a patient you have not seen before, you are seeing for the first time, then you should assure yourself that death was natural before issuing a death certificate. If you have the slightest reason to suspect that the death was unnatural, you should refuse to issue a death certificate and send the body to a government hospital. Now let me stress a very important point in the end. Cardiopulmonary resuscitation means you are dealing with a dying patient. In this situation, the relatives are very tense, anxious, and under intense psychological pressure. So it is equally important to tackle the relatives properly. Otherwise, someone may start blaming you for the death. You should quickly note as to who is the responsible relative. Tell him that the patient is almost dying and only then start resuscitation. You should order all relatives to be out of the room because resuscitative procedures look very harsh to the near relatives. You should be calm, confident, and keep the relatives well informed about the graveness of the situation. This is a situation where you could be blamed for doing something wrong to the patient on one side and not doing anything to the dying patient on the other side. So you have to be careful, tactful, and get credit for doing maximum for the dying patient by taking well-informed steps.